We've actually come a long way with the last strategic plan, and we'd actually done most of the things that we said we would do. With the support of the research and ethics officers, we've strengthened our governance with Roy and the team. Under Morella's leadership with Louise, we've strengthened the way we do our clinical trials. We've got our clinical trials steering committee, having the clinical research centre established to support our clinicians who aren't part of medical research institutes. So a lot's been achieved, and that's helped us to be very good partners in the establishment of Sydney Research, which has really gone from strength to strength. And you can't have successful organisations unless each of the partners is strong. And I believe that our research plan previously enabled us to do that. And now going forward, the new plan is very exciting because it's to continue to be world leaders in research, to enable us to have excellence in healthcare and to improve the health and well-being of our community, but also adding social and economic benefit for Australia as a whole. And we're going to be able to do that through supporting infrastructure, engaging and collaborating not only with our partner organisations, but most importantly with our patients and their families and the community, not just showing them, the research that we've come up with, but very importantly involving them in the questions and the methodologies that we're going to be implementing. So I'm very excited about the plan. I hope you are all too. And the team who've developed it have just done such a great job in consulting with everyone really broadly. So it is a plan for all of us.
And one of the key successes, I think, having moved through a number of hospital networks, is that we've got a CE that can rattle off such intimate knowledge of specific research events, pull that together in a global framework, not only for our area health service, but also how that integrates with universities, institutes, and other health services around the place. That's the key message for here. I think without that, we wouldn't be where we are. And I just want to give the message out that once upon a time in health, research was a nebulous sort of entity that happened around the edges, and you did it after you'd finished your clinic, when you could find some time, when you could find some money, if you're a particularly inspired individual, often working alone. And the platform you've been presented with today is vastly different for that. It's a platform where research is not only recognised, but some of the success stories are actually demonstrated to everybody, and that can't help but lift the morale of everyone in the unit, number one. Number two, it lifts performance to greater heights. And number three, most importantly, every patient that attends the Melanoma Institute is receiving care that is at the best level available globally. And I guess our aim in doing this is that that's pervasive throughout SLHD and all of our research partners, because that's what we're in the research game for, to try and lift the standard of outcome for our patients. I think that the simple point to which we're all aspiring is that every patient that walks through RPA and all of our hospitals around the area, and that's a lot of patients each year, that every one of those has the opportunity to either participate in or benefit from a clinical trial, either because they're an active participant or because we've demonstrated something that's then been translated into practice to improve their probability of a good outcome. I think that's what we're aiming for, and I think we've got a chance of pulling that off. It's an awfully big job, and I don't think we should underestimate the magnitude of it, but that's target number one. Target number two is that we've got some standouts on the stage, but research isn't all about the standouts. It's about everybody in the departments who's interested being involved and aware of the research programs that are going on and have a chance to have their spot in the sun and do something. And everybody that comes forward and takes on that role benefits.